Thank you, Mr. Chair. You know, people with disabilities were told under the first Trump administration, we're going to let the states put work requirements in place and individuals with disabilities aren't going to lose their health insurance. And that turned out not to be true. The only examples we have of states that imposed Medicaid work requirements ended up kicking people with disabilities off of Medicaid, and my colleagues on the other side of the aisle have admitted Georgia screwed it up, Arkansas screwed it up, but we don't have an example of a state that imposed a work requirement that didn't impact individuals with disabilities. So they've seen this script before. That's why they're skeptical. We keep hearing this bill is to make sure that Medicaid stays sustainable. But if that were the case, we would adopt the amendment from the gentleman from Louisiana, because any savings should be invested in actually ensuring that the costs that are increasing under Medicaid the most are addressed. And that is the cost of long-term care, seniors, individuals with disabilities, because they have much more complex needs. This bill does not invest in long-term care facilities. This bill does not invest in long-term care facility workforce. This bill does not invest in driving down the cost of prescription drugs in a meaningful way. This bill does not do anything to ensure that any of the savings that the states or the federal government sees gets reinvested in the program. And this bill is happening in a larger context where NIH research that helps fund R&D for new treatments and new drugs is being cut, making it that much more difficult for them to do that unless companies invest their own work funds in, which then they're going to want to recover their R&D costs. This bill is happening in the larger context of other cuts that the states are going to have to backfill. And all of that is being ignored in this bill. And all of that is being ignored in the talking points of my colleagues that says, we are going to save Medicaid by addressing undocumented immigrants getting care, a very small percentage of able-bodied people who are not working. There's not enough money there to make Medicaid long-term sustainable if we're not addressing the underlying increased cost of care for seniors, individuals with disabilities. As the population continues to age, as the population continues to have these complex medical conditions, as you continue to have people living in areas where they get pollution, this bill cuts funding to address that. So you will forgive us for being skeptical when the context of what we're doing this bill on is to fund tax cuts. That's what the resolution that congressional Republicans passed, I don't know, a month or two ago said. Find $880 billion in cuts to fund tax cuts. Not to make investments in Medicaid, not to make investments in our public safety infrastructure, not to make investments in cybersecurity, not to make investments in addressing AI needs, not to make investments in environmental sustainability, energy sustainability, or anything else, but to fund tax cuts. So forgive our skepticism that this bill is actually going to do anything to make Medicaid more long-term sustainable, when what it's really going to do is cause 13.7 million people to lose health insurance between what this bill is doing and the failure to extend the tax cuts. 13.7 people will lose health insurance. That will cause costs to go up for everybody else. And this bill is doing nothing to address that either. I yield back.